HHS announced a $50 million pledge to study the causes and potential treatments for autism. And while this investment might sound like a good thing, after all, who doesn't want more money for research? It's not quite that simple.
I think he's going to find that what he is actually proposing is much more difficult to carry out than he expects. His Understanding ASD initiative claims that it's going to integrate diverse data, enabling research to examine complex factors influencing ASD rates. The diverse data is where researchers are going to run into problems. Unfortunately, there's not a lot of information that has been released to the public about the methods that he will use, but what I can say is that some of the fears that we're starting to see show up on social media are going to be difficult to pull off from a data privacy perspective and a research ethics perspective. But at the same time, we do actually have a ton of laws in place that can prevent our full medical record from being released to anyone, particularly when it contains personally identifiable information, things like your name and your birth date. The biggest one that I think will affect his plans is actually the Health Insurance Portability and Accountability Act of 1996.
Do I know that by another name?
You do. You know it as HIPAA. So HIPAA protects the privacy of personal information, and this includes medical history, treatments, diagnoses, insurance details, whatever is your health information that is personal to you, it is protected through HIPAA. This applies to both paper and electronic records. So if you went to a doctor 20 years ago and there's a form on file for you, it is still protected by HIPAA. Each time you see a new doctor, you complete a HIPAA form. So I'm assuming where you've gone to the doctor, somebody has asked you, who can I share your personal health information with?
Yes.
I don't think any of us have ever wrote down the United States government when completing that form. Due to HIPAA, no researcher is going to be able to contact any doctor and basically ask for a list of names of all their autistic patients.
Okay.
What they're going to have to do after completing multiple ethics forms with their organization, a university, an associated clinic, and receiving approval from a review board is they might get a total count of autistic patients. They might get, we have 8 patients with autism.
But not their names or who they are.
Not their names.
That is a little bit relieving.
Yeah, and I know that a lot of parents are scared about this too. You don't want your child's name on a list, but the other law that's going to come into play is the Family Educational Rights and Privacy Act, or
FERPA?
FERPA, yes.
Somehow that's like less catchy than HIPAA, but I still like it.
FERPA actually restricts a third party's ability to access student records without consent of the parent or a child of a legal age. If your child is receiving additional services in school due to an autism diagnosis, the school cannot report that specific information just because they were asked. We're again talking about this idea of aggregated counts, as in this school serves 9 children through our special education program.